So when we're considering cervical facet joint radiofrequency denervation, this is a procedure which is used to treat patients who have neck pain. Often patients will have neck pain if they have degenerative changes in the neck, for example, degenerative spine disease in the neck. If we look at this model of the spine, the top part of the spine here is the cervical spine. It's made up of these little building blocks. These are the vertebral bodies. In between these vertebral bodies, we have the shock absorbers of the spine, which are the intervertebral discs. If we look at the back of the spine, we have little paired joints, and these are called facet joints. Now, the procedure of radiofrequency denervation, we will bring a patient into hospital. We will put them under an X-ray and then either administer a small amount of sedation, or the procedure can also be done just with local anaesthetic. We will identify the facet joint and under the X-ray, and essentially what is done is a small probe, a radiofrequency probe, which is a very, very thin little probe, is carefully put down to the facet joint. On the side of the facet joint, there is a little nerve, the medial branch, which essentially supplies nerve supply to that facet joint. That's essentially all its function that it has in its life. We have a special machine, radiofrequency machine, and what we do with that is we first of all identify that we have the correct nerve, and we do that by using motor and sensory stimuli, and we locate the nerve as accurately as possible. We do this by talking to the patient to make sure we're absolutely in the right place. And once we've identified that nerve as accurately as we can, we will anaesthetise the nerve with a small amount of local anaesthetic, and then we will heat the nerve up to about 80 to 90 degrees centigrade, and we'll actually burn the little nerve off. And that process is called radiofrequency denervation. As with all procedures, there are benefits and risks. The benefits are pain relief. It takes about 10 to 14 days to work, sometimes less, sometimes more. Risks: failure, local bleeding, bruising, infection, discomfort, they're all minimal. Patients may get some numbness, weakness, pins and needles afterwards. That's just local anaesthetic spreading. Theoretically, it is possible to cause irritation and damage to the underlying nerves, the nerve roots that come out. But with this particular technique, there are so many checks and balances to make sure that you pinpoint that nerve, that the likelihood of causing any other damage is remote. We use clinical indicators, we speak to the patient, we use the machinery, we use X-ray in 2 different planes, so overall it is a very safe procedure.